Today, in this video, I'm going to speak about a fairly common problem that affects many of us, issues with the shoulder. And in particular, I'm going to speak about the symptoms that people might experience with shoulder issues. So how does one experience shoulder pain? Now, the pain often from the shoulder is sort of in this area, and it may be just during times of rest, or it can be when you start moving your shoulder, like to do simple activities like placing something on a shelf, taking some object from a shelf, reaching behind your back to scratch your back, or to reach out to objects. That's when you probably experience pain. Now, how does it start? In some people, there is no particular cause or reason for starting. In some people, they have a simple fall or they have a sudden jerk of the arm. At that time, they might not feel much of pain or problems, but then later on, you start getting this shoulder pain in certain movements. Now, if left ignored, obviously the pain can progress and it can become a more chronic pain, which can lead to pain at rest. Now, the shoulder pain itself is not just pain which is localized in this area. The shoulder problem can be present with pain which is radiating up the shoulder into the base of the neck, or it can even radiate down the arm, further into the elbow, and into even the tip of the fingers sometimes. Another common symptom that people get is stiffness of the shoulder or lack of movement in the shoulder. Now, this can be as a result of weakness of the muscles which help you to move your arm and your shoulder, or it could be as a result of stiffness, wherein there is difficulty in just moving your arm in various directions. Oftentimes, the problem arises as a very minor problem, so people usually ignore it because most of our activities can be done sort of with a minor range of movement. But when it comes to extremes of movement, like for example, when you have to reach out to something overhead, or if you have to reach behind your back, or if you have to reach behind your back like that to scratch your back, then they realize that there is a problem and they cannot do those movements quite easily. So it may be a result of weakness, wherein there is a muscle issue, where you're finding it difficult to lift your arm up, and often instead of just lifting up straightforward like this, people tend to do a trick maneuver wherein they tend to shrug their shoulder and then lift their arm up, or they struggle to lift their arm up and they sort of go into this area. So that kind of movement is very representative of a shoulder problem. Another common symptom with regards to the shoulder is something called shoulder instability, wherein a person might not have full confidence in the use of the shoulder. There may be recurrent episodes of shoulder slipping out of the joint or dislocations, or it's a general weakness in the use of the shoulder. Now, most of the time, this is seen in younger patients, wherein the first episodes happen with a frank dislocation of the shoulder as a result of an injury, like a fall, trauma, where the shoulder jumps off the joint. It gets reduced and either in the hospital or it goes back on its own. And then following that, patients tend to get repeated episodes of dislocations or instability. Now, some people do inherently have very lax ligaments and lax joints, and they are able to move their shoulder in certain ways, which most of us cannot. That's an inherent problem with the muscle patterning, which can be corrected with simple measures like physiotherapy, exercises, and generally not to try and do such things. Whereas the problem that arises as a result of trauma can become a chronic problem and a disability, because there is continuous episodes of dislocations, and over time there may be a lot of damage to the cartilage, which can result in more early wear and tear of the joint and even arthritis in the future. So it's important that this problem is looked into. Now, often the patients present with either frank episodes of dislocations, or they might have problems with things like throwing an object, or even reaching behind to pull, for example, seat belt, pulling curtains, and in those positions, usually the shoulder jumps out of joint. So it is a symptom which can be quite disabling and should not be ignored, and treatment should be sought out much early in the course of the problem. So as we've seen, these are the common symptoms. So you have pain, decreased movement of the joint, or you could have instability and repeated episodes of dislocation. Now, all these problems in the early stages can be treated very easily with just simple measures such as rest, taking medicines for it, avoiding certain maneuvers and movement which produces the pain. And most of the conditions do settle with just these measures. Sometimes you may have to supplement this with a bit of exercise regime and physiotherapy, but majority of cases settle down with these measures alone. But there are some conditions which can progress or it can remain untreated if ignored, and can lead to further problems and disability. Now, shoulder joint is a very mobile joint, and we rely a lot on its mobility for a normal day-to-day function. So if you have any problems with the shoulder, it tends to affect your sleep, your normal day-to-day activities and functioning, and it should not be ignored. It's always important to get these problems checked out by a specialist who knows about the shoulder and who can provide you with effective treatment for this condition. So one may ask, what are the things that I can do to avoid shoulder problems? One thing is, before you start any sporting activities, you have to do stretches and warm up. So nowadays we see a lot of what we call weekend warriors who have suddenly taken up a sport like badminton or tennis or cricket, wherein there's a lot of overhead movements and sudden movements involved. With these movements, there's always a risk of getting shoulder injuries. So one has to always do appropriate stretching and strengthening before progressing or starting this kind of activities. The other things that we can avoid doing in our day-to-day activities is to avoid sudden movements wherein we involve a sudden stretch of the shoulder, sudden throwing of objects without adequate warm-up, lifting heavy objects at an arm's length wherein all the force goes then to the shoulder, and to just take care before you start any new activities. These are the things that we can do on our own to try and prevent the occurrence of shoulder problems. But shoulder problems can happen in spite of all the precautionary measures. So when that happens, the things that you can do in the initial stages is to rest that area, not move the joint to the extreme range of movement, but at the same time maintain the movements that you have got by keeping it going. Avoid lying and sleeping on the side of the problem, because that puts a lot of strain on the shoulder. And also obviously don't do anything strenuous or things like lifting heavy objects. If at all you have to lift something, then pull the object or get close to the object and then lift the object like that, rather than stretching and lifting it and carrying it in that position. So these are the things that we can do to try and preserve the shoulder as much as we can. So that brings us to the end of this video. I hope this has been of help to you. As a part of this series, I'll be coming out with further videos in the coming weeks about various orthopedic conditions. So do stay tuned for more. In the meantime, stay healthy, stay fit, and keep moving. Namaste.
If you like this video or found it useful, don't forget to like, share, and subscribe. And if you want to be notified of further videos coming up, please do press the bell icon which is next to the subscribe button.